A former IMPD officer injured in the line of duty is pretty frustrated with a workers' compensation claim involving the city of Indianapolis and the police department.
Santos Cortez was working the day a drunk driver ended his career back in 2012. One of his doctors says an available treatment for his wounds could keep him healthier and even extend his life.
He called Rafael hoping he could get answers for why his claims were stalled or even denied. And Rafael Sanchez joining us now in studio with what's really preventing this crucial medical care.
And so claims of this kind are complicated. Santos Cortez in the world of insurance is considered catastrophically injured. That is not a media term. Every day his pressure wounds, which I will show you only once, they're very graphic, are daily reminders of why he's looking for the best medical solutions possible. His health and living to see his kids grow old are his top priorities in a city that he loves.
If they called me right now and said, hey, we want you to come in and talk to people, or we want you to come help us, I would drop everything and go do it, because that's how much I still want to be the police.
Santos Cortez still has the passion to serve. In June 2012, a drunk driver crashed into his police cruiser, leaving him paralyzed after only 5 years with IMPD.
It always chokes me up. My dad was a cop. My brothers, sisters, aunts, uncles were all police officers in Chicago. I had a dream, and it got taken away.
Santos, in a wheelchair forever, was assisted with a specialty van, a home, and continues to receive an annual salary. Grateful for that, his concern now is for his future and his health.
My wife's not a nurse. My wife works 2 jobs. We have to wake up at 5 o'clock in the morning so she could spend an hour and a half to change bandages. And I'm not thinking I'm anybody special or anybody that deserves more. I just want to be able to get what I can to help me live.
He found a local doctor through Helio Health to treat his multiple pressure wounds at his home. The images of those wounds are graphic. The doctor's office reported that the initial treatments showed great improvements. In November, Broadspire, the city's workers' compensation administrator, said in writing that the treatment provided was not authorized and not ordered by the treating physician. Santos decided to switch medical care to the new doctor. That office provided a treatment plan to the city and pointed out that workman's comp was already covering a similar treatment on his feet, and not allowing it on his other wounds is medically inconsistent and putting him at unnecessary risk. But a denial was issued for transfer of care.
Why do I have to fight so hard to get stuff I need? Why?
In a separate email, Broadspire wrote the following: "This is not private health, and the patient does not get to go outside the process and choose their own physician."
When you try to call, you never get any answers. It's always blame. Blame this person, blame that person, blame this person. And it's like, I just want answers.
He also wants answers about repairs to his specialized wheelchair.
And you could see this, the wheelchair is not supposed to do this. I've been waiting for the insurance to pay for them to get this fixed. Everything, it's always a waiting game. On the issue of that wheelchair, the city says it's been working for months to get a repair tech to fix the chair that he got just last August. Now, late this afternoon, Santo let me know that a tech is set to be at his home tomorrow afternoon. We'll keep you updated on that. On the health claim, I've suggested that both sides who want the same thing, a healthy person, meet behind closed doors and come up with a plan. We'll see what happens. The city of Indianapolis did provide me with a lengthy statement. In part, it says the following. Since 2013, the city has provided extensive care and support to Mr. Cortez, ensuring that his needs are met through a coordinated system of approved providers. At no time has the city stopped or denied medically necessary care prescribed by his treating physicians. They go on to say long-term catastrophic injuries often involve complex care decisions requiring collaboration among multiple medical professionals and service providers. The city remains committed to working cooperatively with Mr. Cortez and his medical team and is open to continued dialogue focused on his health and well-being. We'll keep you up to date on this story. Their full statement, the city's, is provided right now and posted on our story you'll find on our website. reporting live, Rafael Sanchez in the studio. Now back to you.
Rafael, thank you so much. Now, if you want to call Rafael, you can dial the number you see there on your screen or send an email to callrafael@fox59.com.